All right, welcome to this afternoon. This is our 1 o'clock presentation of the webinar, and we have two very exciting presentations today. Well, way this is going to work is that we will have both of our people present. I'll introduce one of them, they'll present. I'll introduce the second one, they'll present. And after the presentations, we'll have time for question and answers. If you'll go ahead as they're giving their presentations and put your questions in the chat box, then we can, they'll feed them to me and I'll ask the questions. That way we don't have mics going on and off and any sort of problems with that. And as soon as Dr. Bufong is able to get in, we will let him take over for me. In the meantime, let's start with effects of economic, social, and political factors on the tourist arrivals in the USA. Zachary Taylor from the Department of Management and Health Science Administration will be delivering our project, and Zachary's sponsor is Dr. Dow. So Zachary, if you will pull up your slides and begin to present, we're happy to hear you.
Perfect. Thank you so much. Can you guys see my slides and hear me okay?
Right. Yes, we can.
Awesome. Thank you. Perfect. So I just want to start off by saying thanks to everyone who is watching this presentation, who took the time out of your day. I know I've enjoyed kind of hearing the different researches that are going on, and it's always exciting to hear how other students are participating in their research. So my research today, the topic is, as we stated earlier, the effects of economic, social, and political factors on tourist arrivals in the USA. So before I dive into the data and all the research aspects, I do want to give a little introduction about who I am, kind of how I got here, and how this research kind of came and started to be. So my name is Zachary Taylor. I'm 21. I'm a VSU alumnus. I actually just graduated in December of 2020 with a BBA in management. So the kind of jump from doing more management-focused things to kind of falling in love with the world of data and research is an interesting story that I'll get into a little bit. But I currently work as a quality assurance analyst at Azalea Health in downtown Valdosta. And like I mentioned, I kind of come from a management background, a management major. And I actually, when I started at VSU, I was not too fond of data and research and math and that side of business, the business world, until as I was taking my classes at VSU, I started slowly learning how much I enjoyed digging through research and digging through the data and digging through kind of the analytical side of things. And I slowly but surely found a passion for data and research. And that really kind of culminated in the fall of 2020 when I took an econometrics class with Dr. Denau. And that kind of was really the start of where I kind of fell in love with all things data and research. And that was actually where the topic that we're talking about today kind of came to fruition and kind of was brought to light. We had discussed a couple different topics, and this was the one that really stuck out. And so it's here at VSU and in the econometrics class that I really found that love for research, and it's kind of why I ended up here today. So I'm actually planning to attend Georgia Tech in the spring of 2022 to kind of pursue even further that data analytics program and kind of get a real deeper experience into what the world of data and research is. So that's the background of how this all came to be and kind of how we got here today. So I'm just going to go ahead and jump right into the research and talk a little bit about the first thing is the purpose of the research. So this is kind of the what of what we're doing and what we plan to do, what we have already done, what we've kind of defined as what we want to learn through this research. So that can be broken down into three main points, and the first one is to examine what effect economic, political, and social indices of foreign nations have in shaping the tourism arrivals in the United States. So we're going to be taking a look at kind of the worldview of how not just things that happen in the United States or the surrounding areas, but kind of how the world affects the tourist arrivals in the US, kind of broadening that horizon from just domestic influences to bringing it into a worldview of, well, how does this country affect the tourist arrivals here, or how do things that happen in countries that you may not expect have an influence on our tourist arrivals. So we're excited to see kind of how that pans out and how this ends to be. The second thing that we plan to determine is to what degree those effects influence the tourism industry. So once we've kind of quantified that there is an effect and what is kind of shaping our tourism, we want to see how those effects influence our tourism industry. So an increase in one country, does it decrease our tourism arrivals? Does it increase? And just kind of see how those things interact and what kind of relationships we can plan out and map out. The third big thing in our what category is to understand how we can use those effects to predict future trends. So this is one of the things that I'm most excited about, is kind of once we get that data and once we get those relationships defined, kind of seeing what we can do with it and what kind of impact we can make, and seeing this is what we know and this is what we can predict to effectively say this is how we can use it in the future. So whether that be for predicting for the tourism industry or predicting for other expenditures, so that you can see how these effects have a real world impact. And it's going to be exciting to see once it all comes to fruition. So that's our kind of our what. The next thing I want to talk about is our how. So our methodology of how we plan to get those relationships and how we plan to get that data outlined. So the first thing we have planned is to combine the data points using a panel technique to examine the relationship between the foreign indices and the domestic indices, and to see how these relate to each other and how this affects our tourism arrivals here in the United States. So we have spent a lot of time going through different models and different kind of outlines, and this is what we have decided was going to be, for the data that we have, is going to be a great tool to kind of see how these relationships work and how we can actually take it from our idea and put it into, this is our practice of, this is how we have our results. So another huge part of what we want to do is expand upon previous research, kind of including the most relevant data that we have available, especially with 2020 and the COVID pandemic, and kind of seeing how those things react and how the things were moving in that system and how it can affect our data today. So we want to take the most relevant data that we have and look at what has already been done, but also kind of find out where we can fill the gaps that may have been missed in previous research by putting new variables, new determinants to realize how we can get our results to be the most accurate that we can in this time. So now that we have the what we're going to do and how we're going to do, a big one, and this is one of my favorites, is the why it's important. So the kind of motivation behind why tourism arrivals should be even considered, why it's a big deal. And during the research and kind of looking through this topic, I was kind of shocked myself to figure out just how important of an industry tourism is. So there are multiple reports put out by the United Nations World Tourism Organization that kind of outline just how large the tourism industry is. So the industry of tourism growth is $1.7 trillion in 2019. So it's a very large industry. And actually, the thing that surprised me the most, that it was growing faster than merchandise exports. So I think it grows 3% faster than the growth in all merchandise exports in the world, which is amazing to think about, just how important that industry is to our economy and to what we can use it for. And it actually outpaces the growth of the global economy. So tourism growth and tourism arrivals and expenditures are growing at a faster rate than the economy of the world, which is an amazing thing to study out. So I'm excited to see how we can get to understand this better and figure out how we can predict it, and to see how things can be utilized after this research comes about. So of course, no research is complete without looking at the previous research and seeing what contributions others have made in the field. And when you look up tourism research and you find the previous research, it's a very widely researched topic. It's very in-depth. There have been a lot of people that studied it over the years, and that's definitely something we're drawing from and getting from that wealth of information to figure out what is the most accurate data we can use, and how can we take upon the things that other people have done, their hard work, and kind of take it to the next step. So through all this research, I have just a few things listed out here, but it's usually broken down into kind of how we wanted to approach it was maybe look at the methodology of what are they using to predict their variables. Maybe they're using things like regression, or maybe they're using different neural networks, maybe just different techniques that they're using to see how this data can be used. And that was something that was super valuable in the process of kind of determining what we wanted to do, was to see how other people used it. Another big factor of looking at the research that's already been done was kind of looking at the variables that other people have used, kind of seeing what worked and kind of the common themes throughout each bit of research, and seeing the things that maybe had never been looked at before, the variables that no one had looked at, no one had taken the time to define them out, that we want to try and see their significance in this area and kind of see how we can take this into a new level. So again, a lot of this research, it's astounding how much research and hard work people have put into this, so we're super thankful and grateful that there's such a wealth of information out there, and we're excited to kind of build upon that and take it to the next step and kind of see how we can make a new contribution to this field and kind of bring that level up a little. So for the data that we're using, we're actually very grateful to have a very nice data set. We're obtaining data from the International Trade Association's I-94 arrivals program. So this program is categorizing all of the arrivals to the United States, and it's very well laid out. It's released on a monthly basis, the data from everyone that comes into the United States. It's also, they release an annual report with kind of the breakdown of each country. So the total data that we have lists out the top 52 countries of tourism arrivals to the United States. For our research purposes, we narrowed that down to the top 18 countries from the period of 1999 to 2020. So the countries that we're going to be using in our research is Mexico, Canada, the United Kingdom, Japan, South Korea, Brazil, China, India, France, Germany, Colombia, Australia, Argentina, the Dominican Republic, Ecuador, Spain, Italy, and Chile. So all of these countries, the top 18, make up 87% of the tourist arrivals to the United States. So we wanted to make sure that we had a large enough sample that we could really get accurate results and get real data in there that we could see exactly what's going on. So we narrowed it down to these countries, and it's a very exciting to see the data in place and kind of see how we can use it. So looking at the data overall, you can see on the little graph on the left kind of the trends of tourism arrivals throughout the years from 1999 on into 2020. And it's a very steep increase going from, broken down into our top two. Obviously in the top 52 countries, the first two are Canada and Mexico, being bordering countries. They provide the most tourism arrivals. So those are broken down into the orange and gray bars respectively. So you can see the kind of trends that those go along and see how those have historically moved and how many arrivals we've had from those countries versus kind of overall. And so this, in the data set that we have, it makes up 95% of the total arrivals. So there are 52 countries that make up 95% of the tourist arrivals to the United States. So our data set is very broad and it's exciting to see kind of this huge amount of data that we can use. So if you look on the little graph to the right, you can see the change from 1999 to 2019, that 20-year period. You can see the total overseas increased 65%. Canada arrivals increased 46%. And the one that actually caught me by surprise was in the Mexican tourism arrivals increased by 407%. So this was an exciting kind of, when we were going through the data, just seeing that it was a little bit different than the 46% of the 65% before, kind of seeing that this was a very large number, and we're excited to kind of see how that plays out and how those variables we can determine why this happened, what can we do to explore this a little more. So we're super excited to see how that breaks down in the future. And of course, with 2020 being such an interesting year, it would be amiss to go through the research without kind of talking and speaking on what 2020 did to tourism arrivals and how it affected that industry. So this chart shows kind of the decrease that happened in that year. You saw it on the chart before, the kind of sharp decline. So the total overseas arrivals dropped 81%, whether that be due to travel restrictions, just people just not traveling, or the like. 2020 was definitely a very interesting year. So that's something we're navigating around and trying to see the best way to include that data in our model and the best way to explain those kind of differences and those kind of changes that we see. Again, Mexico down 62%, Canada down 77%. So each of these kind of regions and even the total is a sharp decline in 2020. So that's something we're going to take a look at and see what effects that had on the industry and how we can use that data in the future to predict and see what we can do in the future. So for the model that we're using, like I mentioned earlier, we're planning on using a panel data set and kind of looking at different variables that maybe from the previous research that we found were very accurate, significant variables that we want to include, but also kind of branching out into things that may have never been studied or things that may have never been thought about to include in this kind of study. So we're going to be trying out a lot of different variables. So obviously some of the most important would be GDP per capita, consumer price index, exchange rate, some of the classic common variables in this instance to kind of see how this reacts with each other. But we also want to include some variables for if a country was going through a global crisis. Like we know we have the 2020 was a global crisis for the economy, the recessions in 2008, and those sort of the things that could affect this industry and how this could be shaped. And then another on the topic of just kind of interesting, unique variables, something like the political party of the US president in the United States. Like, is there a difference between a Democrat and those kind of shifts? Does it affect the tourism arrivals? And does it affect how people travel to the US? So these are just a few of the variables. We're going through a list of what we want to include and what we have to kind of get the most in-depth that we can get and kind of make it as most accurate and effective as possible. So we're super excited to see what we come up with in the final process as we start building out that final model. So that's all I have for this presentation. I want to say thanks so much for everyone who listened, for Dr. Denau for giving some help and insight on this, and for everyone listening, and for all the people presenting today. I know I've learned that research is not easy to do or to present, so I appreciate you greatly for your hard work, and go Blazers.
Thank you for your presentation. That was incredibly interesting. And I look forward to the questions because I've already seen some of them over here. Our next set of presenters, we have two people presenting. It's going to be analysis of spatial equity of pharmacies in Georgia. This is Anthony Oliveira and Ben Singletary from the Department of Physics, Astronomy, Geosciences, and Engineering Technology. Their sponsor is Dr. Liu. So if you all will load your slides and begin.
Hello. Okay, yeah. So are you guys able to see this?
Yes, we are.
Okay, in that case, that means you're able to hear me too. So, two birds in one stone.
Right.
So I'm gonna try to do this with my camera on, and I guess just so you guys don't feel like you're talking to or listening to a disjointed voice or something. But nonetheless, yes. So the title of this presentation is the analysis of spatial equity of pharmacies in Georgia. And this was, of course, done by myself and my research partner, Ben Singletary. He'll be popping, or I guess not popping in and out, but he'll definitely be commenting throughout the presentation as well. And then our faculty advisor was Dr. Liu, a fantastic person. Okay, so just a little bit of an intro before we get into the sort of the meat and potatoes of the presentation. In general, pharmacies are important. I think most of us could, probably agree on that. That's something that's kind of universal to a degree. So to fill in the gap of the literature and aid in forming solutions to pharmacy deserts in Georgia, the present study analyzed geographical patterns of spatial equity of pharmacies in the state of Georgia again. So another part of the introduction that's also very important is this idea of pharmacy deserts. So some of you guys might have heard of this, but it's basically as any specific area in any state that is void of pharmacies. And there are two different criteria that researchers use to define pharmacy deserts. So it depends on whether you're talking about pharmacy deserts in an urban area or in a rural area. So of course it's going to be a little different. So for instance, in an urban area, we're talking more than any given point that's more than 1 mile away from the nearest pharmacy. Now in a rural area, it's any given point more than 10 miles away, right? For those of you who have lived in both of those areas, you kind of understand why there has to be a difference between the two, right? So yeah, so like I said, just a little bit of an intro before we get into it. So we will continue here. Okay, so here are our research questions and our hypotheses. Essentially, where are the pharmacy deserts located in Georgia? Which parts of Georgia have more pharmacy deserts? So this was something that we asked ourselves to begin with, right? So like, where are we going to be looking for these pharmacy deserts? And whenever you kind of break up the geography of Georgia, which specific portions of Georgia will have more pharmacy deserts and which ones will have less. So we hypothesized that low-income urban areas, small towns, and rural parts of Georgia will have more pharmacy deserts. And this second part right here should actually be the next question. That's a formatting error on my part. But which socioeconomic and transportation variables correlate with the presence of pharmacy deserts? So we hypothesized that race, income level, unemployment rate, I guess, and poverty level all correlate with pharmacy deserts. And last but not least, which areas of Georgia have access to quality pharmaceutical care and which areas do not? So we expect that suburban areas and non-minority areas have access to quality pharmaceutical care and the opposite areas do not. So again, just a sort of a quick rundown of our questions and hypotheses. So we will continue here. So our literature review in general, right? We looked at tons of papers on pharmacy deserts, and of course we'll have the references slide at the end. But I'm talking somewhere between 30 to 40. So it was a very extensive literature review. So it's kind of hard to put that on one slide. I think you guys are picking up what I'm putting down there. But regardless, race and/or ethnicity, income level, poverty level, and unemployment level are all indicative of pharmacy deserts in general. That was pretty much what we found. And right here, you'll see on the next slide, you'll see a summary. So another very important part of what we found is that there were actually, believe it or not, with all of this large plethora of information that we have in the modern world, especially in the United States, out of all that information, there were no studies that were done investigating the degree of pharmacy deserts in the state of Georgia. Believe it or not, I can't make this up. Believe me, you guys can look it up, right? But nonetheless, yeah. So there were no there were no studies looking into that, which is crazy. And also, there were no studies looking into the impact of COVID-19 on pharmacies in the state of Georgia. So that's why we found that our study was particularly important, because it was filling in the gaps of the current literature, if you will. And to continue, so our methods. So this is always the funnest part for me. I love methods. So essentially, we looked at the pharmacy availability, right? Because pharmacy deserts, what does that really mean? In other words, you can kind of define it as the pharmacy availability across the state of Georgia. So to do that, we collected information of So we collected information on a total of 2,292 pharmacies in the state of Georgia, and we double-checked all of the data using location data, right? And that was something that my research partner Ben actually did using his secret and mysterious ArcGIS skills. Ooh. Very cool. But yeah, so that's actually the total number of pharmacies in the state of Georgia, for those of you wondering. So we used the ASC, or in other words, or the ACS, sorry, the American Community Survey database, to compile information on total population, total employed, unemployment rate, median family income, percent African American, percent Caucasian American, and percent Hispanic American at the county and census tract level. And this is for every county and every census tract in the state of Georgia. So we also used ArcGIS, what I just alluded to a moment ago, to calculate square mileage, road density, and service area analysis for all pharmacies at the county and census tract levels. And like it says there, that's no easy task, and that was something that Ben actually helped us out tremendously with. So I know he'll get into that in just a moment whenever we switch out. But yes, and last but not least, again, we also conducted several correlational and regression analyses, of which the results of which we will be showing you in just a moment. So just bear with me. Just in general, the study area included all counties and census tracts in the state of Georgia. So I've said that quite a few times now, but just to make sure we're all on the same page, that's the scope of our study, right? It's limited to all the counties and census tracts in the state of Georgia. All right, Ben, so we got the maps here, so I'll let you take it over.
All right, thank you. For some reason, I'm not able to get my camera to turn on, so I'm sorry, you're gonna have to look at a gray screen while I'm speaking. But anyways, you got beautiful, beautiful maps to look at instead. So these maps that I had created, they were created using a program called ArcGIS. Different versions are released every year of this, but I'd use the one that VSU has to offer. So these first couple of maps, these show the total population of Georgia and the Atlanta metro area. The reason why we did a zoom in of the Atlanta metro area is because if you can see the small, tiny census tracts in the right map, they are not able to really be seen on the left whole state map. So that's why we did that zoom in on that area to better see the Atlanta area, because it's very dense, right? So I'm going to go to the next one. Oh, all right. So, oh, did that go twice? Oh, no, it didn't. Okay. Okay, that was weird. Okay, so the map on the left is the African American population percentage. This was actually not based on a census tract. This was a raster created to give me the finest details showing the African American population percentage in certain areas. Now, you could see that you can make out simple shapes that are the census tracts, but I really wanted to be more specific, especially in the Atlanta area, where you have millions of people living in such a confined area versus South Georgia, where people are more spread out. And then on the right side, you can see the African American population, not the percentage, just total numbers on the right, again, the right. Right. Awesome. So on the left-hand side, we have the Hispanic American population. This is, again, just total numbers. On this, we did notice on this map that there was high Hispanic American populations northeast of the Atlanta area. I'm not sure if you can see my mouse, but I'm going to just wave it around just in case you can. It's northeast of the Atlanta area. I think that's Gwinnett County. And also in sparse places in South Georgia. And then on the right-hand side, you can see the Hispanic American percentage. Most of the state is very low in percentage of Hispanics. However, there is a slightly higher percentage, again, northeast of Atlanta, and a little bit further northeast of Atlanta, up in Dalton, and then sparse places in South Georgia. Oh, that didn't work. Okay. All right. In this slide, this shows two other minority groups, the Asian Americans and Native Americans. These both populations have very, very small numbers. However, on the left map, you cannot see it, but the Asian American do have a higher population number around the northeast side of Atlanta. And then the Native Americans are pretty sparsely populated across the state. All right, so the left map, this is the household median income. This is looking at all households. This includes singles as well as families. So number of people is not really involved in it too much. It's just general houses. So, and this, again, this is the median income. So up in Atlanta, north of Atlanta rather, you're going to have a higher median versus South Georgia, because, you know, that's the Atlanta area, higher costs of living. So they're going to have higher wages for the most part. And I want you to also take note of right south of Atlanta. You can see this little white smudge. That is the area in which it has a high African American percentage. If y'all can remember back to that map a couple of slides ago, just wanted to point that factor out. And then on the right-hand side, you have your senior population. There's a good bit of seniors in the southern region, but there's a lot more seniors in our northern Georgia, especially kind of towards the Blue Ridge area. And normally, I would probably assume that that is due to retirement areas. It's beautiful up there, right? All right, so on our left-hand side, we have our Georgia roads. You probably cannot see it really well, but every single road is displayed on that map. However, they're grayed, they kind of give a gray shade, and they're not easy to see, normally because those roads tend to be not really significant due to there are a lot of dirt roads, or not so much as traveled roads. So we like to highlight the state highways, US highways, forestry roads, and interstates. And then on the right-hand side, we have the Georgia road density, and these are where your densest roads are. Again, this is also including your dirt roads. So they're your darker areas where it may not seem like they should be roads there. There are roads, they're just, however, dirt roads. And those are by miles of road, or feet of road by miles, square mileage. So sorry. Now on the left side, we have the population below the poverty level. And this is actually pretty, I would say it's pretty even throughout the state. There's a good number of people all across the state with the same amount of population in each census tract that is below the poverty level. And then on the right-hand side, you have the percentage of population below the poverty level. And again, it's pretty even throughout. There was not really many hard areas to point out. But I do want to note that you may see on the right-hand side along coastal Georgia, that is actually the ocean. That is actually not really an actual census part. That's just the ocean. I just wanted to point that out. All right. Now, these two maps on the left-hand side, this is the unemployed population. There's a good bit of people up and around Atlanta that are unemployed. However, that is due to the increased population in that smaller area. And then on the right-hand side, this is our veteran population. Again, higher up and around Atlanta due to the fact that that is a higher population area. All right. So the left-hand side is our Caucasian population. Now we do, obviously, again, higher population up in Atlanta. However, if you want to notice two things, right south of Atlanta, you can see there's slightly a lighter color area. That means that's due to the fact that there's not very many Caucasian Americans living south of Atlanta, where the higher Black percentage is. And also through the center of Georgia, there's a lighter color, mostly white, of not so high Caucasian populations. And those areas actually tend to have a higher African American population. And then on the right-hand side, we have our major road density. This is looking at your artillery, your interstates, US highways, and your state highways. These are your densities for that. Oh, that didn't work. Hold on. Okay. So this is a map created for the rural pharmacy deserts. Everywhere that you see in green, this is what by the by the map standards, this is the area that's not counted as a pharmacy desert. However, everything outside of out of the green is what is counted as a pharmacy desert. Now, This map was created using a network analysis. This is basically where you take every road in the state of Georgia and you do a drive distance, not necessarily time, because speed limits are not included. So we just did it by distance. So you have distance in there, and I basically drew a nice little line in every single direction outward from a pharmacy, 10 miles, then 20 miles, then 30 miles, and then 40 miles to include the entire state. And then this is how I derived my answer to include, or to have where my actual pharmacy deserts are. I wish I could zoom in so y'all could see that better. Now this map is the urban area of the Atlanta metro area. Everything that you see in green is not your desert area. Everything outside of your green is your desert area. Now this is included the entire way because this is the actual Atlanta metro area. It's all, I think it's around 11 counties, including Fulton, obviously. And you can see that majority of this area is in the desert region. All right, Anthony, I will hand it off to you.
Very cool. Thank you very much, Ben. It is I once again. Good job on that, Ben. That was awesome. Thank you for sharing that with us. So basically, I'm pretty much about to give you all the numbers behind a lot of what he just talked about. So here we go. So pharmacy availability, we conducted correlational analyses and logical regressions, like I alluded to before. And we did this to determine which variables best correlate with the number of pharmacies at the county and census tract level. So what we found was the following. The top variables at the county level consisted of total population, total employed, employment density, population density, poverty rate, and percentage of Caucasian Americans. Now, the top variables at the census tract level consisted of total population, square mileage of census tract, a percentage of population over 65, median family income, and unemployment rate. Okay, so this is kind of just a picture. This is like a screenshot of the results on SPSS. So we used the logical, or I guess I should say, we calculated a logical regression to see which variables best predicted, pharmacy deserts, or pharmacy availability in the particular or specific counties, if you will. And what we found was that if you look at this one right here, you find, and if you look down here, it's going to tell you like, what variables this calculation includes. And it includes employment density, population density, poverty rate, Caucasian American population, and total employed. And you will see that it has an R-squared value of 98.3, or really just 0.983, but 98.3%, of course. And that's very high. That's like insanely high. Especially for me, I'm a psych major. Most things we do in psychology, you're not going to really find an R-squared that's quite that high. So that basically means that it accounts for a substantial amount of variance. So so those variables are great predictors, in other words. So the logical regression at the census tract level was quite different. If you can see, with all of these predictors kind of laying on top of each other, it only calculated to about 0.101 or 10.1%. So of course, like I said, is very different. But yeah, we'll talk about why we think the results were the way they were in just a second. And this was actually from another study that we did. So it's actually pretty interesting because it couples very well with everything we're talking about right now. So one question we had on a survey we made in another study was, how many miles away is the pharmacy you normally use? And this was done in Georgia as well. And as you can see, we're talking the vast majority of people say that the pharmacy is 0 to 10 miles, of course. But look how many people say 10, pretty much above 10. Let's look at it like that. And these are not the final results. The final results are even, are very different, of course. And there are actually more people in these categories there. But that's just to show you that there's a significant portion of the population that lives over 10 miles away from the closest pharmacy. So here are our conclusions. So to just reiterate the research questions from the beginning, where are the pharmacy deserts located in Georgia? Which parts of Georgia have more pharmacy deserts? We hypothesized that low-income urban areas, small towns, and rural parts of Georgia have more pharmacy deserts, and our hypothesis was confirmed. So for our second hypothesis, that was also confirmed, and as you can see right here, our expectations as far as which areas would have more access to quality pharmaceutical care, that hypothesis was also confirmed. So sparsely populated, i.e. rural areas, non-Caucasian areas, low-income areas, areas with high percentages of poverty, and areas with less people employed have less access to pharmacies. So here are some general public health policy suggestions. So we posit that governments should provide incentives to build more pharmacies in rural and predominantly minority areas where the pharmacy deserts are more prevalent. Pharmacies should also provide more telehealth options and home delivery services in the areas that have more pharmacy deserts. Here are references. See 2 pages of references, quite a bit. But yes, so this is it. Thank you, guys. Thank you for your time.
All right, well, thank you for that. That's a lot of information and a lot of very important information. We're now going to open it up for some questions and answers, and I'm going to start with a question for Zachary. This question is from Chesty. It says, what would your advice be for students studying statistics as part of their major, for example, psychology majors?
Yeah, this is a great question. So for me, kind of not coming from a statistics background, I had always looked at, for me, statistics was a class. It wasn't a mindset. It was just something that I had to take for my major. And then once I got into it, I realized just how much of statistics was in the world around me. You hear, anytime you listen to the radio, watch TV, you hear the statistics that are thrown around, and kind of once you take the time to understand what they mean, and you kind of get the view that the mindset is, this is the world that I live in, you can understand it better by seeing those statistics play out in your life, whether they be something big like statistics that are played in the news, or whether it's just something small around your house, that you can kind of get that mindset of, it's more than just the class that you take, but it's kind of just a way of seeing the world around you, and kind of through those numbers and through those kind of through the data that is coming at you every day. And that is one of the coolest things I think I've found, kind of falling in love with this kind of data thing, is that you can collect data on almost anything. It doesn't have to be academic. And this is going to sound crazy, but there was a time at work that we would order lunch from Buffalo Wild Wings, and we would put it all in a spreadsheet so we could figure out who would pay for which amount, and kind of collect the data on what wing orders we did. So we would see, oh, 26% of the time we ordered garlic wings, and just something crazy like that, as small as seeing statistics on just a really silly scale, kind of brings it into perspective that it's more fun than it is just kind of that grueling, this is my statistics class that I have to take. So advice for someone kind of going into that statistics realm, whether if you're not a huge fan of statistics, or you've never done it, and you just want to get kind of that mindset of that this is something that affects your life in a way that it's amazing to see how it interacts with everything that you do. So for me, that's what made it fun, was seeing that everything around me is in that data statistics realm, and just seeing what I could do with it. And now going into this research, seeing how it can impact other people, and kind of the other things that I can do with this data, and the things that I learned through statistics. So it was super cool to see just the importance of it in daily life.
Thank you for that. Anthony and Ben, a question for you from Precious. Do you think that Georgia actually has pharmacy deserts, because different places like Walmart and Publix have pharmacies in their stores?
I can answer.
Oh, yeah,
Excuse
Ben,
me.
you can go for it, man.
I can totally. I'll answer it. All right. So, what is your name again? Precious. Okay. Hi, Precious. So, I think it could be literally. You can probably put it in a matter of perspective, because not everybody has that easy, quick access. You're driving right down the road to go to Publix or Walmart or just a normal mom and pop store. where you can go get your pharmaceutical goods. So me, taking in my case, I live about an hour away in the middle of nowhere. If I needed to go get my drugs, something I needed for my sickness that I'm having or something like that, I'm already feeling bad, I have to drive an hour to go get my goods. So basically that desert, desert definition that we actually used is actually from the FDA, what they used for food deserts. We used the same definitions for our pharmacy deserts. Anybody in an urban area living this far away, or anybody living in a rural area living this far away, you're included into this desert. So yes, by definition, deserts do exist, and you don't. Not everybody has that easy access to it, because you also don't need some people don't have the financial means to drive a good distance to get their medication. So there's more than one factor that can go into that, just besides distance as well.
Thank you. No, that's a wonderful answer. We have time for one more question, so we're going to throw it to Zachary. And Zachary, do you think, this is from Dr. Swan, do you think that the cost of travel factored into your analysis?
Yeah, absolutely. So this is something that we thought was interesting, kind of going through the different research and seeing how other people quantified that cost of travel. And one of the things that we're planning to do is including the price of petroleum as a proxy for the cost of that travel. So kind of seeing whether it be airfare from other countries or gas prices in contiguous regions, kind of seeing how that affects the arrivals and how that relationship kind of balances out. So it's definitely something we want to include in our research to see what effect that costs, whether it has any, whether the relationship is important, and how significant that is in our research. So that's definitely something we're planning to include in our research.
Well, thank you, and thank all three of you for your hard work and your sponsors for their support of you. This has been a very informative session, and I can see there are so many more questions over there. Unfortunately, we just don't have time for them all, but you can contact these students and their advisors with your questions if you'd like. Thank you again for coming. We're going to take a brief break so we can get our next group in here. Thank you all.